Welcome to Care and Cure. I have with me Dr. Anand Sharma, specialist orthopedician from NMC Medical Center, Sloan. Thank you, doctor. Thank you for being with us
Pleasure.
today. And our topic today is low back pain, right? Doctor, low back pain, a lot of people find it as a very commonly occurring event. For example, they say when they wake up in the morning, I have low back pain today, my back hurts today. But people don't understand that it is a serious issue that needs to be addressed, right? Especially if it happens very often.
Yeah, low back pain is actually one of the most common clinical entity that is encountered by any clinician worldwide.
Right.
Uh, most of the time, it is considered as a 80% of the population, human population, would be suffered from low back pain, and it's very common condition. That's why the treatment part is multifactorial actually, and sometimes it's difficult.
Yeah.
And a lot of factors are involved
Okay.
to look for any cause
Cause,
of.
right. Yeah.
So it's very difficult sometimes to treat the patient.
Right.
So we should know it's everybody is on risk actually for low back
Correct. Yeah. Right. So it is not something that should be taken lightly, right, doctor? It should be
pain. Yeah,
taken seriously.
it could be the indication of more serious problems like osteoporosis or something.
Right. Okay.
So we should rule out and look into the cause of problem.
Exactly. Especially if it is recurring. It is if you're going through it every day, then definitely there are some
Yes.
alarms ringing.
Yeah, it's an alarming sign of
Yeah.
any
Right.
musculoskeletal health actually.
Correct. So, doctor, you mentioned the causes that we have to first identify the causes. So, can you please explain to our
Causes
viewers
are
what are the
yeah,
causes?
causes are mostly mechanical.
Okay.
Mostly mechanical in young age or middle age group. Mechanical means wrong way of doing routine activities.
Okay.
And wrong way of doing routine activities, wrong posture, poor musculoskeletal health.
Okay.
Intonation of the muscle is not proper. So mostly mechanical causes, for example, strain of the muscles, sprain of the ligaments, and disc herniation or prolapse sometimes.
Okay. Disc prolapse. Yeah. It's very commonly heard these days.
Yeah, mechanically produced actually because of wrong positioning or long standing sitting job.
Okay.
A lot of factors are there actually.
Okay.
Other causes are degenerative causes.
Okay.
Degeneration of a spine actually. That is known as spondylosis of lumbar region.
Okay.
So degeneration of a spine lead to certain sort of changes in muscle, ligament, and bone stock.
Okay.
And other causes are disease and disorders of musculoskeletal system, generalized or localized, like infection, trauma, and tumors, or osteoporosis, metabolic disorders.
Okay. More serious, grave issues, right? Those are all. Yeah. Okay.
We have to go for investigation.
Investigation.
Actually.
Right. Okay. Doctor, now this is a question that's been in my mind as well. When we talk about back pain, is it generally a muscular pain or is it a skeletal pain or how does it?
It's a combination actually.
Okay, combination.
It could be muscular in sort of activities which are producing strain at the muscular level.
Okay.
That is known as stretching of muscle or strain of the muscle of lower back region. Or more severe form is sprain of ligaments.
Right.
And more severe is wedge compression fractures or some.
Okay.
Sort of severity is there.
Right. So it can be a combination also, right?
Yeah. Mostly combination means changes, aging process because of aging process.
Yeah.
Degeneration of muscles, muscular changes would be there, or some ligament hypertrophy or some sort of bone stock weakness in that particular segment.
Okay.
So it would lead to chronic variety of low back pain.
Low back pain.
Yeah.
Okay. And these degenerative causes are mainly seen in the elderly, I suppose, right, doctor?
Yeah.
Or are you seeing a pattern where even young, even middle-aged or young people are getting?
Yeah, some sort of activities will produce earlier changes in. Heavy weight lifters or some sports persons.
Okay.
Or it could be related to poor vitamin D status or calcium deficiencies and other metabolic factors.
Right. Okay.
And aging process is natural, but
Yeah.
other
No
factors.
one can avoid it,
Yeah,
unfortunately.
yeah.
Yeah.
So a lot of factors are there actually.
Right. Okay. So when it comes to activities, doctor, you briefly mentioned certain routine activities can lead to low back pain. So can you
Yeah,
explain
even
some?
simplest of the activities like picking up some pencil or something, very small thing from the floor actually, it would create pain because of wrong posture.
Okay.
Bending with rotation
Okay. Okay.
would be dangerous for your spine, simply.
Bending with rotation.
Yeah, I
Okay.
mean bending
Yeah,
with
and
some
then
sort of
oh.
rotation. It is the most dangerous position of your spine.
Okay.
So even
Okay.
in early age, it would lead to, it will trigger off severe kind of low back pain.
Right. Right. It's strain on the back, right?
Yeah,
Yeah.
absolutely.
Yeah. That's what I've heard doctors advise us, if you've dropped something on the floor, or if you want to pick an object from the floor,
Yeah, yeah,
do
yeah.
not bend, but squat, sit down
Your spine should be perpendicular to floor.
to the floor. So straight, you have to just sit
Yeah,
and pick
and
it
your
up
knee should be bended over the object and keep the object just close to your body.
close to the body. Okay. So simple things that can.
Simple thing, yeah.
Yeah. Right, right, right. Okay. So what are the other routine activities, doctor? One example is this picking something up. What are the other things that can cause the...
Other things are shoe problems can create, I mean, trigger of pain because
Okay.
of shoe it should not be flat actually. It should
Okay.
be low heeled,
Right. Okay.
well maintained arc of the foot and
Okay.
cushioned heel should
Okay.
be there.
Right. Okay.
And other factors like your routine activities, long traveling, long drivings without any interruption.
Interruption. Okay.
So a lot of factors are there, and lower back region is a particular segment which is a combination of mobile versus fixed zone of spine.
Okay.
That's why the sort of problem is very common
Common. Okay.
in
Okay.
routine activities.
Right. Right. Okay. Okay. Right. And also sitting for a long duration, even at
Yeah,
workplaces, right?
you have yeah, absolutely.
Yeah, sedentary lifestyle. That's what we say.
Sedentary,
If you sit for a long time.
sitting jobs,
Yeah.
drivers, or some weightlifters.
Weightlifters. Okay. So when it comes to diagnosing low back pain, once somebody has, has figured that they have low back pain and it's constantly causing discomfort, how does the diagnosis begin, doctor? And what are the tests that we do?
Basically depends on various investigations are required. For simplest is a plain X-ray of your lower back region.
Okay.
And other blood tests to rule out any organic cause, infection or something. And scanning musculoskeletal health actually should be assessed with the level of vitamin D and serum calcium and all these things.
Right.
Uric acid or all these. And in some cases we got to go for MRI actually.
Okay, like
MRI.
a detailed scan. Okay.
Yeah, in some chronic cases.
Okay.
We got to go for MRI.
MRI. Right. Because even if you have, you mentioned blood tests and all that, right, doctor? Something just struck me that even a case of kidney stones begins with back pain, right? Low back pain.
That is sort of referred pain actually.
Yeah.
Referred pain could be there because of kidney stones, because of some intestinal problems like irritable bowel syndrome or something. And pancreatitis and a lot of things are there actually, which can refer back to
low back pain. So those are all like secondary causes of low back pain.
Absolutely.
Right.
They should be ruled out actually first.
First you rule all those out and then go for the root cause.
Then we should go for whether it is mechanical cause or whether it is organic cause.
Okay.
Or whether it is metabolic musculoskeletal cause.
Okay.
We should look for that with various investigations.
Right. And when it comes to planning the treatment, doctor, does it depend on what caused the low back pain? Firstly, the different, like you said, mechanical causes are there, organic causes are there.
Yeah.
And so, how does the treatment plan work in that case?
Treatment plan is first of all we can go for simpler medicine and all these things, muscle relaxants and anti-inflammatory medicine. Make the patient comfortable first, and then we should go for, as per the cause, mechanical cause is there, we should go for mechanical treatment, that is physical treatment.
Okay.
We call that physiotherapy.
Physiotherapy, right.
Physiotherapy is combination of physical modalities, combination of modalities actually.
Okay.
For example, ultrasound therapy and electrical stimulation of nerves.
Okay.
And some sort of exercises.
Okay.
Various exercises are there.
Right,
Flexion regime, extension regime exercises are
Okay.
there too. It depends on patient to patient actually, which kind of physical therapy is required for that particular case.
Okay. Now, physiotherapy is of course something that's recommended by a medical practitioner, right, doctor? It is not something that you can start at home, because people believe that it's just exercise, so I can do it at home.
Physiotherapy doesn't mean only exercise. It's a combination of physical therapy. Physical therapy means we are changing the tissue, the nature of the tissue, alignment of the tissue, and everything. I mean, by physical forces or physical nature of energy. I mean, ultrasound, electrical, lot of things.
Okay.
So physical therapy is the key treatment part in lower back pain in more than 90% of the cases.
Okay.
Surgery is required in only 2% of the cases.
Okay. Surgical intervention.
Yeah, surgical intervention is required only in 2% cases, and causes are different actually. Surgical indications are different.
Right. Okay, so when it comes to the other treatment, alternative treatment plans, like there are a lot of people that are opting for acupuncture and other alternate medicines these days.
These are actually form of physiotherapy.
Okay.
Physical treatment. They are putting pressure. Acupressure means they are putting some pressure on the particular area of pain.
Yeah.
So it will induce some sort of neurotransmitters and endorphins and others to reduce the pain actually.
Okay.
So it's a variation of physiotherapy actually.
Okay.
That is a different field. Not
completely. It's alternate medicine, isn't it?
Yeah, this is different actually.
Right.
Not for allopathic person.
Yeah. So doctor, you mentioned about surgical intervention required only in very few cases. So what are the causes that can require a surgery for?
Most important indication for surgery is neurological deficit. Neurological deficit may be there along with low back pain.
Okay.
Because of entrapment of your nerves for a longer period of time, there would be some sort of changes in the nerve leading to neurological deficit.
Okay.
For example, numbness in the limb or some sort of weakness would be there. So in that case, we got to go for surgical decompression of the nerve. For example, discectomy, removal of disc, if it is compressing the nerve for a longer time. So we should go for surgical intervention if it is not responding to conservative
treatment. Yeah. Okay. So in case of all these, like for example, the disc compression, is it something that you see in the elderly, or is it something that can even be
middle age?
Middle age,
young age. After the age of 20 to 50 years is the range for disc. Yeah.
Okay.
Discogenic pain is more common in 20 to 50 years of age.
Wow. Okay. That's majority of the population.
Yeah. It's mechanical. That's why it is mechanical problem.
And what are the causes for this disc?
Causes of disc: wrong posture, heavy activities, sudden onset of doing some activities of weightlifting, and without doing some sort of gym activities without warming up.
Warming up is critical.
Yeah, warming is. A lot of factors are there actually.
So, doctor, when it comes to therapies like yoga and aerobics and other, they're not exactly medical therapies, but routine activities as workouts. So there are people who decide by themselves that, okay, I have low back pain. Now there are certain yoga asanas, certain yoga moves that will help with low back pain. Would you advise that as a specialist orthopedician? Would you advise people to do that, or?
Local application is psychological.
Okay.
Psychological factors are there only. Putting something on his skin.
Yeah.
I don't think it would help.
It would not help, right? Okay. Unless it's a proper diagnosed plan of treatment.
These are counter irritants actually.
Right. Okay.
To reduce the pain.
Okay.
For a short period of time.
Right. What about yoga, doctor?
Yoga is absolutely a form of physiotherapy actually.
Okay.
Sort of stretching of your muscles.
Yeah.
And wearing and tearing of muscle would be healed up with the stretching exercise. It's a part of physiotherapy.
Okay.
Science is different, but scientifically it's a combination, I mean, related to physiotherapy.
Related to
somehow.
physiotherapy.
Yeah.
But even then, doctor, would you advise a patient suffering from low back pain to just say, look up on YouTube and start practicing certain
No,
yoga?
absolutely no.
Yeah.
Because every patient is a different patient. Actually.
Correct. Yeah. Yeah.
A lot of causes are there, which cause is requiring physiotherapy. Physiotherapy is a wide, I mean, a lot of modalities are there.
Yeah. Right.
So which modality you have to choose,
Correct. Yeah.
and which kind of exercises you are going to do. Every patient is different patient.
Yeah.
Actually. We have to assess the patient, go through investigations, look for the cause, and then we have to choose the modality which is
correct. Right. Doctor, we were talking about this earlier.
Yeah.
When it comes to modern therapies or modern techniques of dealing with and managing low back pain, what are the latest advancements that we have?
Certain patients are there not responding to conventional treatment.
Right.
For example, all the physiotherapy and surgery and all these things. The recent advancement is coming up as a stem cell therapy actually.
Okay.
Stem cell therapy is a different sort of treatment which is introducing stem cell taken from your own bone marrow or some adipose tissues, re-injecting into your site of pain. Okay. To repair the healing, I mean, repair the wearing and tearing of that particular tissue, ligament or muscles or some sort of bony changes will revert back.
Okay.
So it is in experimental stage actually.
Right.
Another option, I mean, recently introduced disc replacement is also there.
Disc replacement.
Yeah. After removing disc, you have to put inside some artificial.
It's artificial.
Yeah, artificial implantation of disc to maintain the gap. Okay.
But does it guarantee
recurrence is very I'm sorry.
No. So does it guarantee normal lifestyle, doctor, after that in terms of movement and
no, absolutely not.
Conducting your daily activities?
Yeah, absolutely.
Right. And recurrence is avoided, right? That's what you were about to say. Yeah. Okay. So doctor, now when it comes to as parting words, when it comes to managing lifestyle so that you don't end up in the situation where you're constantly suffering low back pain, what are the lifestyle changes that you would advise for a
most important part is regular exercises of your lower back muscles.
Okay.
You have to tone up your muscles to support lower back region. Okay. And proper posture. That's the key factor. Regular exercises and maintain your weight. Yeah. Weight maintenance is very important because the key factor in weight of trunk is responsible for leverage of that stress actually. Correct. Yeah. At that particular point. Right. So and change your shoes as well. Right. Okay. Modify your activities. Avoid prolonged traveling, driving, or long standing jobs. And learn how to pick up things from the floor. Actually, learning is very important. Correct. Learning to do it the right way, because we are all used to bending and picking things up. Yeah, it's unhealthy. What sort of learning is required? That is also part of physiotherapy. Correct. Now, what about supplements, doctor? I've heard a lot of people taking supplements for relieving especially when it comes to degenerative skeletal and muscular disorders. A lot of things are available in the market, but I don't think without any physical activity or something, they would help you. Correct. Yeah. Most important are vitamin D and calcium level. Okay. Vitamin D is a key factor for musculoskeletal health actually. Okay. So we have to maintain vitamin D status, calcium status, and physical activity should be proper. Right. Especially vitamin D, I think the source is the sun rays. So here, I think a lot of people are deficient. Vitamin D deficiency is very common. It's more than 90% actually. Yeah. So especially, and there are tests, right, doctor, to determine if you're deficient in vitamin D. So you can easily understand if that is causing the back pain. Yeah, absolutely. It's not the absolute cause of back pain, but overall musculoskeletal health. Okay. We have to maintain that level and do some sort of physiotherapy, exercise, manage your weight, change your shoes, modify your activities overall, that would be
more than enough, right? All right, doctor. Thank you so much. It was an extremely informative session that we had today on low back pain. That was Dr. Anand Sharma, specialist orthopedician from NMC Mysloan. Doctor Sandarshikan Agrekinnavar, you need to just WhatsApp us on our number. Doctor, the contact details and consultation hours will be shared with you. Thank you for watching Care and Cure.